Hello, my name is Samar El-Bekai, and I'm pleased to present this audience made up of Indigenous healthcare professionals working for Alberta Health Services with an important topic on increasing cervical cancer screening in Alberta's Indigenous communities. This is the agenda for today that we will be working with, and we'll talk about human papilloma virus, also known as HPV, is the main causative agent of cervical cancer, and screening for this virus is currently done in Alberta by a pap test collection in a physician's office or clinic, whereby sexually active women between the ages of 25 to 69 get tested. Indigenous populations in Alberta, specifically in Alberta's North Zone, encompassing most Treaty 8 nations, have disproportionately low rates of screenings for HPV at 57%. The importance of screening for cervical cancer is that it may reduce disparities in cancer outcomes by detecting these cancers early at the most treatable stage or prevent cancer from developing. These disparities have resulted in Indigenous women having higher rates of cervical cancer and cervical cancer mortality compared to non-Indigenous women. In this presentation, we will explore evidence-based, culturally appropriate strategies to improve screening uptake and the role you can play as Indigenous healthcare professionals. The main causes of reduced cervical cancer screening as related to the socio-ecological model are demonstrated in this figure. This is based on a review of qualitative studies on narratives of Indigenous women with HPV infection as well as healthcare workers across different geographic and income level settings. I'm not going into all the detail of it, but regardless, this will be a good resource for those of you interested in a more detailed information on barriers to cervical cancer screening. The key barriers as related to Northern Alberta include geographic isolation, especially for those living on reserve, leading to difficulty accessing healthcare services, limited awareness and knowledge of HPV and cervical cancer screening, lack of culturally appropriate healthcare, language barriers, screening inconvenience, and privacy concerns. An innovative intervention that is gaining attention to increase cervical cancer screening uptake is HPV self-sampling. These self-collected swabs have the advantage of being cheap, convenient, painless, easy to perform, and private. This intervention can increase cervical cancer screening, empowering women through placing screening in their own hands. Women collect a self-sample and return it to a healthcare professional directly or by mail. This method overcomes social, geographical, and cultural barriers linked to lower screening rates. It is proven to be as accurate as clinician-collected samples, and studies have shown that women are twice as likely to seek cervical cancer screening offered as self-sampling compared to standard of care screening. As shown by research, in order to ensure success of HPV self-sampling, it needs to involve these two key strategies: community-led approaches and culturally safe healthcare practices. Your role as an Indigenous healthcare professional in community-led approaches would involve educational workshops where you can offer training sessions on proper self-screening or storytelling or powwow sessions, emphasizing the importance of regular self-screening as a preventative measure. You will also be responsible for creating educational materials about self-screening in collaboration with Indigenous community leaders and elders. Another area you would be involved in would be in Indigenous community-led outreach programs, where you can provide information about cervical cancer and self-collection, the importance and benefits of screening, and addressing patients' concerns. You have the powerful ability to communicate in the participants' native languages. This will overcome language and cultural barriers and foster trust in the screening process. Those of you who are primary healthcare nurses and community engagement workers can help women understand the results, reduce anxiety, and ensure follow-up care. All of these strategies can increase engagement of Indigenous communities in HPV self-sampling. Studies have proven this, where there was a 39.1% pooled participation difference for community mobilization and outreach compared to traditional method. This indicates the effectiveness of personalized, community-driven strategies. Cultural safety requires for healthcare professionals to reflect on interpersonal power differences, theirs and that of the patient, requiring them to question their own biases, stereotypes, and prejudice that may be contributing to a lower quality of healthcare for Indigenous patients. For instance, many Indigenous individuals prefer to consult family members or respected elders before making medical decisions, reflecting traditional communal decision-making practices. Additionally, topics such as cervical cancer may be considered taboo, requiring culturally safe communication. Addressing these sensitivity through cultural safe approaches can help build trust and improve participation in preventative healthcare measures. Therefore, you, as Indigenous healthcare professionals trained in cultural safety, would be able to communicate the significance of screenings in a culturally safe manner and to support individuals in self-screening practices. This will empower patients while fostering trust. Studies show that culturally safe healthcare approaches not only improve patient engagement, but also contribute to better health outcomes. They emphasize that a more inclusive and equitable healthcare system can be created by centering Indigenous voices in healthcare decision making. The following table summarizes the role of Indigenous healthcare professionals using the socio-ecological model at each level. We talked about many of these points in previous slides, but I would like to bring to your attention institutional and policy headings, which we haven't talked about. Those of you who work for the Indigenous Wellness Corps, IWC, can coordinate implementation of self-screening with Indigenous elders and community leaders, and train other Indigenous healthcare professionals to provide guidance and support for women engaged in self-screening. At the policy level, you can advocate through collaboration with the Alberta Cervical Screening Program for integration of self-screening into existing healthcare policies to ensure long-term success. An example of this integration is we already have in Alberta practitioner-led mobile services which offer integrated testing like mammograms, pap tests, and fit tests. You can advocate for incorporating self-screening into this service to reach remote areas and improve access to cervical screenings in your communities. And finally, to achieve success, coordination and cooperation with Indigenous elders and community leaders will foster trust and engagement. We must ensure that healthcare delivery is culturally safe and aligned with community values. By you, as Indigenous healthcare professionals, collaborating closely with healthcare organizations to integrate HPV self-screening into existing health services, we can ensure that screenings are offered in a culturally appropriate manner and the success of self-sampling in the long term. Implementing these culturally appropriate strategies will increase trust, engagement, participation, and in turn will increase cervical cancer screening rates in your communities. You, as Indigenous healthcare professionals, have the ability to bridge existing gaps in preventative healthcare, ultimately empowering Indigenous women to take control of their health outcomes. Thank you for allowing me to speak to you in this important topic, and I welcome any feedback and questions. Thank you again.